I'm a student respiratory care tech, and the doctor orders for my patient Charles Ashant, his date of birth uh, February 2nd, 1970. And here is the physician orders to administer 2.5 milligram of albuterol and 500 microgram of atrovent via medication via nebulizer every 4 hours. And here is my order. Okay, and here's my stethoscope, flow meter, pen, paper for my documentation, pulse oximetry, and here is my supplies. So I'm going to go to the patient's room. Knock.
Guys, come on in.
Okay. Hey, my name is Hagos Med. I'm a student respiratory care tech. The doctor orders you 2.5 milligrams of albuterol and 500 microgram of atrovent, the medication nebulizer every 4 hours. And before I start the procedure, do you have any question for me?
Not really.
All right. Let me confirm your name. Can I have your name?
Charles Asante,
Your date of birth?
020270.
Perfect. Let me match with your wristband. All right. Perfectly match. All right. I'm going to arrange you in a sitting position. Is it a comfortable seat for you?
Yes.
Perfect. All right. Here. All right. Before I start the procedure, I'm going to take your vital sign, and if you have questions, ask me. Okay?
Okay.
Have your index finger. Check your heart rate. And we'll check at the same time his pulse oximetry. That's good. It matches. Can you hold your arm like this? And I'm going to pretend the patient is not knowing me because I'm checking his respiratory rate, but for the video purpose, I'm checking my respiratory rate. The patient's respiratory rate. All right, you can relax. Okay, I'm going to start taking his. I'm going to check your lung sounds. And deep breathing. Deep breathe in and out. Deep breathe in. Deep breathe in. Deep breathe in and out. Deep breathe in and out. All right. Can you lean forward for me? Deep breathe in. Deep breathe in. Deep breathe in. Deep breathe in. Deep breathe. Deep breathe. All right. Here, easy. to plug in my flow meter and hook the pipe. Squeeze it right in here. I'm going to put first 2.5 milligram of atropine, and I'm going to put again the 500 microgram of I put already 2.5 milligram of atropine albuterol, and I'm going to put again 500 microgram of atropine. I put both of the medications. I'm going to close the cap, the T cap. The pipe. I'm now going to tighten the mouthpiece. I'm going to hook it like this. Alright, before I start the procedure, I'm going to take the patient. Alright, Charles, I'm going to put this mouthpiece on your mouth. Don't bite the mouthpiece with your teeth, and try to close your mouth with your lips closed and tight, and just breathe normally in between. Just keep deep breathing, and the medication is I'm going to plug in the flow meter, and you're going to see the mist. That's the medication, and you have to swallow it, and in between just keep deep breathing, okay? And whenever you put this mouth, don't bite it. Keep your mouth sealed and close it, okay? All right. And I'm going to put it the pulse oximeter, because when I'm giving the medication, I'm going to assess your heart rate, okay? I'm going to check on my flow meter to 8 milliliters per hour. Okay, see this medication, you can put in your mouth. Go check after 5 minutes. And in between, keep deep breathing, okay? Okay. Can I help this little guy? I'm going to check this tab, because some of the medication are residue in the bottom of the nebulizer. Alright, after 5 minutes, the heart rate is not increasing more than 20%, so I'm going to continue the procedure, and the procedure is going to continue 15 to 20 minutes. The respiratory rate, heart rate is not increasing greater than 20%. BPM. Alright, let me tap. Just breathe normally, and in between keep deep breathing, okay? Alright, tap again. We're almost done. Yeah. Alright, it's almost 20 minutes, and all the medication are used. Okay, can I have it? Alright, rub down the oximetry. Alright. Can you cap for me here? Alright. Alright. supplies in their place, so they're going to use every 4 hours. The mouthpiece. Cap in here. And the C cap. To dump this residual medication on the sink. Okay, put this supply in here. Here. All right, you can use your close your mouth mask. And I'm going to assess you again, your pulse oxy, your heart rate, because I got already the manual heart rate with pulse oximeter, so I'm just going to check your heart rate from the pulse oxy. At the same time, the patient is not knowing me, I'm checking his respiratory rates at the same time. Perfect. Alright, I'm going to check again your lung sound. Can you deep breathing for me? Deep breathe. Deep breathe. Deep breathe. Deep breathe. Deep breathe. Perfect. Can you lean forward? Deep breathe. Deep breathe. Deep breathe. Deep breathe. Deep breathe. Deep breathe. All right, you can relax right now. All right, the breath sound is improving after the medication. Okay. All right, Charles, let me arrange your seat. Is it comfortable? It raise up, bed down. Is it a comfortable seat for you?
Yes.
All right. Here is the call button. If you need anything, just press the call button. Any available nurse or respiratory care, they are going to come and assist you, okay?
Okay.
Do you have any question for me?
No, I'm good.
All right. Take this thing with me. Let me clean the stuff. All right, Charles, have a good one.
Okay, thank
And
you.
I'm going to go to the nursing station to document. Alright, I'm here in the station. I record productive yellow tick, productive cough, yellow and tick secretion on it, and I just record heart rate before and after, respiratory rate and pulse oximetry before and after. I record the date and time and everything and the medication placed on it. And here is my documentation for today.